Biopsy A window into the body. A biopsy is a medical procedure in which a small sample of tissue is removed from the body and examined under a microscope. It is an important diagnostic tool that helps doctors determine the cause of various medical conditions. A stomach biopsy. Identifying stomach ulcers. Biopsy helps distinguish between stomach ulcers caused by Helicobacter pylori infection and those caused by other factors. Assessing side effects of nonsteroidal anti-inflammatory drugs. NSAIDs. Biopsy helps determine whether stomach ulcers are caused by NSAIDs. B. Small intestine biopsy. Assessing malabsorption. Biopsy helps determine the cause of malabsorption, such as celiac disease. Identifying the cause of anemia. Biopsy helps investigate whether anemia is related to malabsorption in the small intestine. C. Liver biopsy. Diagnosing tumors. Biopsy helps determine the type of cancer in the liver, allowing doctors to develop a suitable treatment plan. Diagnosing cirrhosis. Biopsy helps assess the extent of liver damage, particularly in cases of cirrhosis. C. Liver biopsy. Diagnosing hepatitis. Biopsy helps determine the cause and severity of hepatitis, supporting effective treatment. Assessing treatment response. Biopsy helps monitor the effectiveness of treatment, allowing doctors to adjust the treatment plan accordingly. D. Infection testing. Identifying infections. Needle biopsies help determine if a patient has an infection. Finding the cause of infection. Biopsy helps identify the type of bacteria or fungus causing the infection, supporting effective treatment. E. Inflammation testing. Identifying the cause of inflammation. Biopsy helps determine the type of inflammatory cells and the cause of inflammation, supporting accurate treatment. 2. False negative biopsy results. False negative biopsy results can occur when the tissue sample taken is not representative of the entire tumor or area being examined. This can be due to several factors, such as too small biopsy sample. A small biopsy sample may not be representative of the entire tumor or affected area. 2. False negative biopsy results. Incorrect sampling location. The biopsy sample may be taken from a location without cancer cells or inflammatory cells. Technical errors in sample processing. Incorrect staining or preparation of the biopsy sample can lead to inaccurate results. Note: 2. False negative biopsy results. A false negative biopsy result does not mean that the patient does not have the disease. Doctors need to carefully consider all clinical information and other test results to make an accurate diagnosis. In some cases, a repeat biopsy may be necessary to accurately determine the condition. 3. When a biopsy of a mass returns inflammatory tissue. When a biopsy of a mass returns inflammatory tissue, it could be due to one of the following reasons. The mass is chronic inflammation. The mass is a result of a prolonged inflammatory process and not cancer. 3. When a biopsy of a mass returns inflammatory tissue. The biopsy sample is not representative. The biopsy sample may have only taken inflammatory tissue surrounding the tumor, not the tumor tissue itself. The tumor has been successfully treated. The tumor may have been completely removed, and the biopsy only took inflammatory tissue. Conclusion: biopsy is a crucial technique in medical diagnosis. Biopsy results are part of the doctor's overall assessment to make an accurate diagnosis and appropriate treatment.